Hepatitis A is a highly contagious liver infection caused by the hepatitis A virus, HAV. This virus is one of several types that lead to liver inflammation, impairing the liver's ability to function. Understanding the nuances of hepatitis A, its transmission, symptoms, and prevention is crucial for maintaining public health and personal well-being. What is hepatitis A? Hepatitis A is a viral infection that affects the liver, causing inflammation and affecting liver function. The hepatitis. A virus is primarily transmitted through ingestion of contaminated food and water or through direct contact with an infected person. Unlike other hepatitis viruses, hepatitis A does not lead to chronic liver disease, and most individuals recover fully without permanent liver damage. However, the disease can cause severe symptoms and complications, particularly in vulnerable populations. Symptoms of hepatitis A usually appear a few weeks after exposure to the virus. However, not everyone infected with HAV will develop noticeable symptoms. When symptoms do occur, they can range from mild to severe and include unusual tiredness and weakness. Many individuals feel unusually fatigued and weak. Nausea, vomiting, and diarrhea. These gastrointestinal symptoms are common and can be severe. Abdominal pain, discomfort or pain, especially on the upper right side beneath the lower ribs, can indicate liver inflammation. Clay or gray-colored stool. Changes in stool color are a notable symptom of liver dysfunction. Loss of appetite. Reduced appetite can accompany other gastrointestinal symptoms. Low-grade fever. A mild fever may develop as the body's immune system responds to the infection. Dark urine. This is a result of the liver's inability to process and excrete bile properly. Joint pain. Some individuals experience aching joints. Jaundice. Yellowing of the skin and eyes is a classic symptom of liver issues. Intense itching. Itching can occur due to bile salts depositing in the skin. Most people recover from hepatitis A within a few weeks, but in some cases, symptoms can persist for several months. When to see a doctor? It is essential to seek medical attention if you experience symptoms of hepatitis A. Early diagnosis and management can prevent complications and reduce the risk of spreading the virus to others. If exposed to hepatitis A, receiving the vaccine or an immunoglobulin injection within 2 weeks can offer protection against the virus. Consult your healthcare provider or local health department for vaccination advice, especially if you have recently traveled to areas where hepatitis A is prevalent. Ate at a restaurant experiencing a hepatitis A outbreak. Live with someone who has hepatitis A. Had recent sexual contact with an infected person. Causes and transmission. Hepatitis A is caused by the hepatitis A virus, which infects liver cells and leads to inflammation. The virus is primarily spread through the fecal-oral route, meaning tiny amounts of infected stool can contaminate food, water, or surfaces, which are then ingested by another person. Common modes of transmission include contaminated food and water, consuming food or water handled by an infected person who did not wash their hands properly after using the toilet. Close personal contact, direct contact with an infected individual even if they are asymptomatic. Sexual contact, engaging in sexual activities with an infected person. Eating raw shellfish, consuming shellfish from contaminated waters. The virus can survive on surfaces for several months, making hygiene and sanitation critical in preventing its spread. Risk factors. Certain populations are at higher risk of contracting hepatitis A, including travelers to endemic areas, regions with poor sanitation and high HAV prevalence, such as parts of Mexico, Central America, and South America. Household contacts. Living with an infected person increases the risk of transmission. Men who have sex with men, MSM, sexual contact can facilitate the virus's spread. People with HIV, immunocompromised individuals are more susceptible to infections. Homeless individuals, poor living conditions, and limited access to clean facilities increase risk. Recreational drug users. Drug use, particularly in unsanitary conditions, can facilitate HAV spread. Complications. Hepatitis A generally does not cause chronic liver disease or long-term damage. However, in rare instances, it can lead to acute liver failure, especially in older adults and those with pre-existing liver conditions. Acute liver failure requires immediate medical intervention and may necessitate a liver transplant. Prevention. Preventing hepatitis A involves vaccination and practicing good hygiene. The hepatitis. A vaccine is highly effective and typically administered in 2 doses, 6 months apart. It can also be combined with the hepatitis B vaccine. The Centers for Disease Control and Prevention, CDC, recommends vaccination for All children at age 1 or older if not previously vaccinated. Homeless individuals. Infants age 6 to 11 months traveling to endemic regions. Family members and caregivers of adoptees from endemic countries. People in close contact with infected individuals. Laboratory workers handling HIV. Men who have sex with men. Travelers and workers in endemic areas. Recreational drug users. Individuals with chronic liver diseases. Travel safety precautions. When traveling to areas with high hepatitis prevalence, follow these guidelines to reduce the risk of infection. Wash fruits and vegetables. Use bottled water to wash produce and peel them yourself. Avoid raw meat and fish. Consume only fully cooked meat and seafood. Drink bottled water. Use bottled water for drinking and brushing teeth. Avoid uncertain beverages. Steer clear of drinks of unknown purity and avoid ice in beverages. Boil tap water. If bottled water is unavailable, boil tap water before consuming. Practicing good hygiene. Good hygiene is vital in preventing hepatitis A transmission. This includes frequent hand washing. Wash hands thoroughly with soap and water, especially after using the toilet, changing diapers, and before preparing or eating food. Sanitizing surfaces. Regularly clean and disinfect surfaces, particularly in communal areas and kitchens. By understanding hepatitis A, recognizing its symptoms, and taking proactive steps to prevent infection, individuals can protect themselves and others from this contagious virus. Vaccination, good hygiene, and mindful travel practices are key measures in combating the spread of hepatitis A and ensuring public health safety.